Hi, I'm Dr. Neil Schultz. Welcome to April's BeautyRx Live. This is supposed to be the third week, but actually we're doing it this month, the fourth week. So here we are in the fourth week of April. It's Viewer Question Week, and we've answered questions from YouTube viewers yesterday. Today we're doing BeautyRx Live, and tomorrow we'll answer questions from the dermtv.com site. Through streaming video today, of course, I'll answer your questions about both BeautyRx products as well as any other related skincare issues that you have. The BeautyRx skincare products that we're talking of course, are the same patient-proven and award-winning products that have been giving my patients more beautiful, healthier, and younger-looking skin for over a decade. So we're going to start with the first question today, and that's a question from Shirley. Good afternoon, Dr. Schultz. Do you know if silicone-based makeup primer is bad for the skin? What are some of the pros and cons? Shirley, actually, that's a good question, and silicone-based makeups really are not, they're really good for the skin because the silicone is just a vehicle in which the makeup pigment is dispersed to enable it not only to apply more evenly, but then the vehicle, the silicone-based vehicle, actually evaporates. It's volatile. So when we think about silicone as maybe being something bad, it's really not a bad product, and it's not dangerous to the skin. We even can inject silicone into the skin where it's not dangerous, although it's not FDA approved for that purpose. But at this time, there's no problem with silicone-based makeups. We have a question from Tom. Can I use vitamin C rescue serum if I'm acne prone? How much vitamin C is in it? Tom, the percent in BeautyRx vitamin C rescue serum is 25%, and it's just fine for acne prone skin. It's non-comedogenic, and it's designed actually for people with acne. Question from Paula. What can I use for dark circles that are brown in color? Paula, actually, the only products that are going to help brown under-eye dark circles are products that will bleach, such as the BeautyRx Brightening Complex, which is hydroquinone-free, or hydroquinone-containing bleaches. In addition to that, you need an exfoliant to get rid of some of the extra layers of dead cells that have too much brown pigment in them. Those are the home care products you can use, but don't forget that the most important thing you can do for those brown circles is to use sunscreen every day, because as effective as we are in trying to lighten those brown under-eye circles, the sun is much more effective at creating more brown pigment. So unless we're actually blocking new brown from forming, you're really not going to make much progress with the bleach and the exfoliant. But using an exfoliant daily and using the bleach daily with sunscreen is the best way for at-home products. If you have access to a cosmetic dermatologist, then of course there are laser treatments for those brown under-eye circles. By the way, you're with April's edition of BeautyRx Live, and if you have a question, go to BeautyRxLive.com, use the chat box, and submit it in the chat box. We got a little bit of a late start, but we're going to move right through all of your questions right now. So, question from Amy. I have dark circles all around my eyes, like the classic raccoon eyes. Are those intrinsically different from under-eye dark circles? Actually, Amy, dark circles around the eyes are really caused by 7 different things. 3 different hues of reds and blues and purples, which are the result of enlarged blood vessels. 2 types of brown pigmentation, which are the result of too much melanin pigment, and also shadows from under-eye puffs as well as lines and wrinkles. So this goes back to the issue of what is actually causing your raccoon eyes, and you're going to need to see a dermatologist to find out which components, which of these 7 components are actually causing your raccoon-type eyes in order to know how to best treat them. We have a question from Stacy. Stacy says, for facial broken capillaries, I've used and continue to use V-beam and IPL laser treatments. Have been dealing with getting rid of them for years. They are stubborn. Are these good treatments to be getting? Stacy, for sure, these are good treatments. V-beam and IPL work in 2 different ways. when they're helping to eliminate these enlarged and broken capillaries, and it's a question of staying with it. It may be a matter of needing to use different settings, different doses, but they are appropriate treatments for broken capillaries. I think that V-beam probably will work better than IPL for for larger broken capillaries, but they can both be used. We have a question from Veronica. I'm just going to see if we can pull that up. Well, we can't get Veronica's question, so let's take a look at another question from Shirley. What is the best way to tan under the sun? And why are some people harder to get tan under the sun compared to others? Well, first of all, the only safe tan, of course, is an artificial tan that comes out of a bottle. There is no safe tan that comes from the sun. When your skin has been darkened, as it is with a tan, that darkening means your skin has been damaged. There's no way around it. So there's no safe tan. And therefore, it's difficult for me to comment on what is the best way to tan from the sun, because you really don't want to tan from the sun. If you're going to have enough damage to your skin, which is going to cause any sunburn, which then later results in a tan, you've damaged your skin. And if you're just getting tanning, even without burning, that tanning, that dark color, is an injury response. It's a response on the part of the skin to deleterious ultraviolet rays, which cause premature aging of the skin, as well as skin cancer. So I'm not going to answer what the best way to get a tan from the sun is, because there is no good way to do it. The reason that some people tan easier and better than others has to do with their genetics and how susceptible their brown pigment cells are, their melanocytes are, to being stimulated by ultraviolet damage. Again, it's just damage. So some people get pigment easier, such as people of Mediterranean descent, as opposed to Irish Celtic descent individuals who have a great deal of trouble ever getting a tan. Let's take a look at a question from Paula. Actually, we've already answered a question about dark circles. Sophia says, is using a well-formulated glycolic acid exfoliant nightly helpful on cellulite? Sophia, I think glycolic acid is better than chicken soup and sliced bread for rejuvenating the texture of the skin and for rejuvenating the color of the skin. But unfortunately, glycolic acid is not going to have any effect on cellulite. Most treatments for cellulite aren't going to have much of an effect on cellulite either, although there are some newer technologies involving body contouring, infrared technology, and certain laser treatments that may be helpful, but I know of no topical product that's going to be helpful for cellulite. John asks, what do you think of using fake tanning products on acne-prone skin? Can DHA clog pores? DHA that John is asking about is dihydroxyacetone, which is the active ingredient in most of the self-tanners that actually causes the staining of the upper layer of the cells that imparts the tan that you're looking to get. DHA is not comedogenic, so there is no intrinsic reason why self-tanners would clog pores. However, understand that self-tanners, like any other skincare product, whether you're talking about moisturizers or sunscreens, comes in different vehicles. And you have to make sure that the vehicle, if you have acne-prone skin, and you're subject to clogging, you want to make sure that the vehicle that your self-tanner is in is one that's non-comedogenic or oil-free or water-based, just the way you would choose the vehicle for any other product that you're going to use on acne-prone skin. We have a question from Talia. Will quitting smoking allow the skin to heal itself such that some of the damage caused by smoking can be reversed? And she's thinking of dilated capillaries, and I'm reading uneven tone and texture, clogged pores, elasticity, stretch marks, loose skin, wrinkles, dullness, and grayness. Well, Talia, I guess you've just made a compelling case for people not to smoke if smoking causes all of these things. And quite frankly, I believe it does cause all of the things that you've mentioned except stretch marks. It doesn't cause stretch marks, but it causes all of those other problems. So if you stop smoking, the skin is going to have an opportunity to do some repair. But most of the things that you mentioned, like dilated capillaries, they're not going to get better. Uneven tone and texture, you're going to need to treat them, whether it's with glycolic products or moisturizers or antioxidants. You're going to need to treat that to make it better. Just stopping the smoking will halt the advancement of all of the problems that the smoking was causing. It will slow down additional problems, but it's not going to help to cure any of those problems that came from smoking. So certainly we know that after sun exposure, smoking is the second worst thing that you can do for your skin, because it actually decreases the blood supply by up to 40%, in addition to subjecting the surface of the skin to many carcinogens. So bottom line, stop smoking, whether it's for your skin, for your heart, or for 100 other reasons, and see a dermatologist to assess how much damage you do have and to get you back on a road to repair and facial rejuvenation. Nora asks, is it true that there are no treatments for stretch marks? Nora, stretch marks are a very difficult thing to treat. There are several lasers that can cause regeneration of some collagen, and by regenerating collagen, that will help old white stretch marks. Anything that causes exfoliation can be of some help, because the act of exfoliation, which removes the excess dead cells on the surface, always sends a message to the underlying cells to plump up, make new healthy cells, which causes an increase in the thickness of the epidermis, which is going to help. Also sends a message to the dermis, make more collagen, make more glycosaminoglycans, which is that semi-liquid matrix in the dermis. All of these things occupy volume, and by occupying volume, they increase the thickness of the skin. So you combine those techniques, such as glycolic treatments, along with microdermabrasion and certain laser treatments that stimulate the production of collagen, and you can have technology that will help improve stretch marks, but most of the help there is going to come from the technology rather than skincare products. Just a reminder, if you have a question, go to BeautyRxLive.com, use the chat box, and we'll be happy to answer your question. And again, this is the 4th week of April, and this is BeautyRxLive.com, and we're very happy to answer any of your questions relating to either BeautyRx skincare products or to any related skincare issues. Sam asks, is it okay to exfoliate the under eye area? Of course it is. Exfoliation should be done everywhere on your facial skin, perhaps with the exception of your upper lids, but the lower lids should be exfoliated. Now, just like any other product for your lower lid, because the lower lid is thin and more sensitive than a lot of the other areas of your facial skin, it needs to be in a special vehicle, number one, which is less acidic than skincare products for the rest of your face, because that skin is more sensitive, and it also needs to be a lower strength. And that's why there are specific products that are made for the area around, under, and next to the eye, because these products have been adjusted to have a different pH, a less potentially irritating pH, a more gentle pH, as well as lower strength. And by the way, BeautyRx has a very, very gentle glycolic eye cream, which is 1% glycolic acid, as opposed to the other starter strengths for the rest of your face, which are 8% glycolic. Lucy said that she watched my video on treating sebaceous hyperplasia with photodynamic therapy and wanted to know if there was a topical way to treat sebaceous hyperplasia that is similar to Accutane. Well, there are 3 treatments for sebaceous hyperplasia. As you mentioned, photodynamic therapy, Accutane, and there are also certain acids such as bichloroacetic acid or dichloroacetic acid, which successfully can treat sebaceous hyperplasia. Topical Accutane products, unfortunately, are not yet developed that are effective. Certainly, if they developed a topical form of Accutane that could sufficiently penetrate down to the bottom of these very, very large enlarged oil glands, which is what constitutes sebaceous hyperplasia, then it might be effective. So while Accutane internally is effective, topical Accutane has not yet been put into a vehicle that is sufficiently penetrating to be able to shrink those oil glands. Amy asks, what causes crisscross lines under the eyes? The crisscross lines, Amy, come from just repeated folding and bending of the skin. Think of a paperclip. You take a paperclip and you bend it back and forth enough times, and what's going to happen? Of course it's going to break. So the same thing is happening with the collagen in your skin. Each time you fold your skin, you are actually bending your collagen. Fold your skin enough times and you will have bent your collagen enough times to break it. When you get enough collagen breakage, you will cause lines, fine lines, which then become medium depth lines. It all depends on which way your skin is being folded in terms of which way the line goes. So the crisscross lines are just testimony to the fact that you're folding your skin in both axes of those crisscross lines. So if the lines are crisscross like this, you're folding your skin this way as well as folding it this way. Folding it this way, folding it this way. And crisscross is just a function, again, of the way you're folding your skin. But don't stop smiling, because smiling is good for you, even if smiling does create those creases that can ultimately break a little bit of your collagen. Shirley asks, if a BB cream has an SPF of 25, do I still need any type of sunscreen underneath the BB cream? Shirley, as I mentioned in my episode on BB creams are combination products on steroids. I love them. Any product that has an SPF of whatever it is, 25, 30, 10, 15, regardless of what type of combination product it is, whether it's in a moisturizer, whether it's in a foundation, or whether it's in a BB cream, will deliver that SPF or sun protection factor. So a BB cream with a 25 is a 25, 3 and 95% protection from UVB rays. So sure, that's enough. You don't need a second sunscreen. The whole point of that BB cream in putting the sunscreen in there was to avoid your having to use additional products and having this great combination product. So again, doesn't matter what kind of combination product your SPF is labeled on. When the SPF test was done, it was done in that product with those other ingredients. So if it rated a 25, it's going to deliver that 25. Just give us one more second here. Okay, we're looking for Pharmacolinker's question. So let me just scan through. Okay, what is the best way to have clean pores? My pores are highly congested. I'm using glycolic acid products, but they do not clear my pores, although they make my complexion look brighter. Thanks. Well, I'm glad that the glycolics are making your complexion look lighter. The best way to shrink enlarged pores is to effectively get the clogs out. You're already using an exfoliant, you're using a glycolic product, but that obviously isn't doing it for you. So my foolproof regimen for shrinking enlarged pores consists of the following. First of all, you need a granular cleanser, and a granular cleanser is one of those cleansers that has those little beads in it, and the purpose of those beads is to try to get inside the pores to actually dislodge the clogs. Now, as you know, I've said many times that I prefer chemical exfoliation that dissolves clogs and dead cells to physical exfoliation, which is what that granular cleanser does. But the type of granular cleanser that I suggest is the one that has round polyethylene beads, not the one with harsh and broken nutshells, which can be too abrasive. At the beginning of your shower, use a good oil-removing cleanser. At the end of the shower, when your pores have been steamed open a little bit, use that granular cleanser and massage it into the enlarged pore area for about 15 or 30 seconds. After that, when you come out of the shower, pat the enlarged pore area dry, and then apply your exfoliant. You should start with an exfoliant of 8%, and over a period of a month or 2 months, be able to build up to using a progressively stronger glycolic as strong as 15%. Using a combination of these two modalities, you should be able to cause enough dissolution of the clogs in those pores to actually reduce their size. If that doesn't do it and you're still having a problem, we have a very special product in BeautyRx, which is our pore complex, and this product is not yet available on the website. but this is the product that I actually give to my patients. And if you want more information about this product, you can get information from my office website and call the office. But this is a special product that's not available to the public yet, which will in fact complement the granular cleanser and the topical exfoliant and reduces pore size in all of the patients that I give it to. Michelle asks, she says, I recommend to use both an exfoliant and a vitamin C product in the evening, but aren't they the same thing? I thought vitamin C is an exfoliant as well. Actually, Michelle, vitamin C is an antioxidant, has nothing to do with exfoliation. So the protective vitamin C serum from BeautyRx is a great antioxidant, and vitamin C-based antioxidants can help reduce brown pigmentation, melanin pigmentation. They can act as a bleach, but they are not exfoliants. For an exfoliant, I recommend BeautyRx Daily Exfoliating Therapy Serum or cream as a starter product, which is 8% for exfoliation. Most people who've watched Derm TV know that I believe there are 3 products, essential skincare products, that everybody has to use every day for beautiful, healthier, and younger looking skin. They are sunscreen, exfoliant, and antioxidant. So the vitamin C is the antioxidant part of this, sometimes a bleach, not an exfoliant, and you need to use a separate exfoliant product. Stacy said that she's been using the 8% daily exfoliating therapy serum for about 2 weeks now. I've not had any dryness or side effects. Is it working for me? Next time, should I bump up the percentage? Stacy, that's what you've told me is perfect. You should start to be seeing that the skin is brighter, a little bit more lucent, more even in color. And after you've used that 8% serum for about a month, then it's time to introduce the BeautyRx Advanced Exfoliating Therapy Pads, and you introduce them as directed on alternate nights and continue to use your 8% serum on the nights in between. After doing that for a month or a month and a half, then it's time to move your daily exfoliating therapy 8% serum up to the 15% maximum strength exfoliating gel and alternate that with the advanced exfoliating 10% therapy pads. And if you can hear some background noise, some clanging, it almost sounds like BeautyRx Live has some outside noise, but we really just have a new puppy in the studio, and that puppy's just doing what puppies do. We have a question from Joy Heisel. What can you use on lips when nothing else works on them? I guess it depends what you've used. When I apply lip balms and treatments, they won't absorb into my lips. Instead, it just lays there and starts to peel. I've tried all kinds of products and nothing works. I can peel a film off them anytime I try to apply something for them. Well, for one thing, Joy, well, I guess that Lucy's doing quite a number here. Okay, Joy, for one thing, what you might try after you've used different types of lip balms, you might try getting an over-the-counter 1% hydrocortisone ointment, not a cream, but an ointment. Now, it's true that lip balms, which are mostly based on wax or on honey products, that these waxy products do lay on your lip. But you need to have it in that consistency or an ointment, petrolatum, Vaseline consistency, in order to get enough protection. So what I would recommend is that in between using the different lip balms you've used, alternate them with a 1% over-the-counter hydrocortisone ointment, and do that 6 times a day, a minimum of 3 applications of each, and see if that, in fact, doesn't make a difference for you. Mike asks, is using a washcloth an effective exfoliant? I use glycolic acid nightly. Well, actually, Mike, a washcloth is a very, very gentle and mild form of physical exfoliation. And if you're using a glycolic acid product nightly, you're already using a chemical exfoliant with regularity. And the washcloth probably just isn't necessary. If you want to use it because you like the way the washcloth feels, or you like what it seems to do for your skin, there's no harm in using it. as long as you're not getting irritated by it. But the backbone of your exfoliation, again, should be a gentle glycolic-based product, and you're already using that, so I think you're in the right place. Cynthia asks, what else can I do to even out my skin tone besides AHA, sunscreen, and vitamin C antioxidant? Cynthia, the other thing that you should add is an actual and direct-acting bleach. So whether you're using the BeautyRx Brightening Complex, which is a bleach that has 5 peptide plant-derived bleaches, or you're using a bleach that's dependent on hydroquinone, whether it's a 2% over-the-counter hydroquinone bleach or a prescription 4% hydroquinone bleach, you need to add a bleach to that skin regimen, using your sunscreen in the morning, then adding the bleach after the sunscreen, and in the evening using your glycolic exfoliant, your vitamin C, which again will add some depigmentation because there are bleaching qualities in vitamin C, and then using your bleach after both of those, your specific bleach. A guest asks, what's good for razor burn? Well, razor burn, to me, means redness and chafing after having shaved. And the best way to treat that type of acutely inflamed or irritated skin is by making up compresses of equal parts of skim milk and water, and in addition, using a very, very gentle cortisone lotion. So the way that's done is by mixing an equal part of skim milk and water into a bowl, taking a piece of cloth that is smooth, like handkerchief or t-shirt material, not something that's rough with fibers sticking out of it like a washcloth, but taking that smooth piece of cotton-type material, putting it in the milk and water, and wringing it out halfway, and just laying it on the area for a few minutes. The milk, the protein in the milk is a very good physiologic buffer, which means it helps restore normal pH to the skin, which cuts down on the burning. As that milk and water evaporates, it takes some of the redness out and cools the skin. And then by applying the cortisone lotion, it also reduces inflammation. And I would recommend doing that 3 or 4 times a day. Cynthia asks, can Latisse really grow eyebrows? Cynthia, it's being tested right now by Allergan, the company that makes Latisse. And Latisse, as you know, is effective at growing eyelashes. But the question about whether or not it penetrates deep enough to the deeper follicles of the eyebrow hairs, the company has not come out with an official position yet. The studies are not completed, but we believe that the studies are going to show that the Latisse is helpful at growing eyebrow hairs, and I recommend to my patients who have a problem with eyebrow hairs that they do use a combination of Latisse once a day with a 5 or 6% minoxidil solution, which is available over the counter, and I recommend using each once a day to help stimulate eyebrow growth and even to help with eyebrow density. Just give us one moment. I have a question from Judy. Can you get fungus or something on your lips? Whenever I apply lipsticks or balms to my lips, they lay there and peel and look flaky. I exfoliate them and then they are fine for a few days. What could be causing this, and how often should I exfoliate them? Well, actually, Judy, the lip has very little dead skin on it normally. It doesn't have that thickened stratum corneum that the rest of your skin has because your lip is a mucous membrane. So we generally don't have the need to exfoliate lips. And if you are having this repeated peeling of your skin or peeling and membrane on your lips, it sounds like it's inflamed. It sounds like there's a medical condition rather than just trying to get rid of dead skin. So I think you're going to need to show that to a dermatologist. A guest says, what are my thoughts on retinol? As I explained in the Derm TV episode on retinol, which is an over-the-counter ingredient, doesn't need a prescription in the United States. When it's put on the skin, as much as 10% can be converted into retin A. If it's converted into Retin-A, then it will do what Retin-A does. So for instance, if you have a 1% retinol solution and you put it on the skin, if it's in a vehicle that allows the retinol to be absorbed, then you can get something that's as strong as a 0.1% Retin-A or tretinoin, which is prescription strength tretinoin. So that would then could have all of the effects of prescription strength tretinoin, which is Retin-A. The problem here is you don't know how much is going to be absorbed. It's not predictable. The absorption, neither the absorption nor the conversion can be predicted. So I'm going to have to give you a thumbs down on retinol for the characteristics and effects of retinol as an exfoliant or for helping with fine lines and wrinkles. I recommend using glycolic-based exfoliants. I think they are the gold standard of exfoliants, better than retinoids, of which retinol is an example. We have time today for one more question on BeautyRx Live, and I'd like to go to Veronica's question, and it's a little bit long, so just bear with me as I read it. Veronica says that in order to follow my advice to have better looking skin, I bought an 8% glycolic acid in gel since my skin is a bit oily, a vitamin C serum, and a not very strong depigmenting cream because I have some very light brown spots from the sun. Since my skin is a bit sensitive, it gets irritated after using the glycolic acid and the depigment. I can't find a 5% glycolic acid, and I've tried several depigmenters, and all of them irritate my skin. What can I do? Is there something for sensitive skin? Sorry for the long entry and any grammar mistakes. Greetings from Spain. Thank you very much, Veronica. Veronica, from what I gathered, the products you're using are not BeautyRx products, and so I can't speak to the potential irritation or issue you're having with sensitivity from the products that you're using, but let me respin that to explain what we do with BeautyRx products with people who have sensitive skin. And we certainly have comparable products. We have a protective vitamin C serum. Of course, we have the daily exfoliating 8% serum, which is the lowest strength, and we have brightening complex, and which correspond to the products you're using. When people have sensitive skin, and some people do have sensitive skin, I start them on the BeautyRx 8% daily exfoliating serum in an area the size of a quarter in front of their ear, just as a test. And we have them do that every other night for a week. Usually there's no irritation because the 8% glycolic from BeautyRx is pH balanced and buffered. So we get very, very little irritation by controlling that pH. If that then is okay, then after a week we have them use it on their entire face on alternate nights. And usually they'll tolerate that, and that will be just fine. At that time, then we start to add the vitamin C. We add the vitamin C on the nights when they are not using the exfoliating serum. So this way we're still controlling variables by only putting one product on the skin a night. We continue this for a week or two. Then we have them start to use the daily exfoliating serum every night, followed by the vitamin C. And after doing that for a week or two, they can start to use the brightening complex. So this is the way, with a combination of different products that work in different ways to help rejuvenate the skin, restore smooth, radiant, lucent texture, as well as to cut down on the brown spots and blotches. This is how we introduce those products even in people with sensitive skin. And we find that you're able to acclimate by introducing them gradually. But don't forget, the products have to be properly made, and you need assurance from the people who are making them that they are okay to be tested and then used in people who have sensitive skin. So thank you for joining us today for BeautyRx Live. I'm sorry we got off to a late start. We had some technical issues. We'll see you again the third Wednesday of May. I want you to know that all of the questions weren't answered. If you want your questions answered, and I'd love to answer them, please visit Derm TV, submit the questions, and they will be considered for the subject of future episodes. And again, as I always do, I'll try to answer as many of those questions personally as I can. So again, from the entire BeautyRx team, thanks for being with us today. Thanks for your support. Continue to use BeautyRx products. Continue to use sunscreen every day, whether it's mine or anybody else's, and we'll see you next month.